Morning. So I have a theory. What if rising healthcare costs are not the core problem in health benefits? What if it's a symptom of how we've built them? I believe the real problem is confusion. In most businesses, you can understand the system by following the money. In healthcare, following the money has us where we are today. We need to stop following the money. We need to start following confusion, because confusion is what is driving cost in our system. And if confusion is the problem, that means we need to go all in on a question you all ask all the time, which is, will my everyday plan members understand this? Let's upgrade the question. Let's push for, does this solution eliminate confusion for my members? Because when we roll out solutions that eliminate confusion, we are attacking a problem that has run uncontained within our healthcare system since commercial insurance has started covering care. That means we're doing something fundamentally different. And that can change what trend looks like in our world, because it can change member behavior. So because confusion is where benefits fail, it's where inefficiency thrives, frustration grows, waste increases, costs escalate, and care gets delayed or skipped entirely. And confusion also teaches our members. It teaches people that in our system, they are not in control. Costs are high, seemingly random to a lot of them, and often that means for many people, care is out of reach. So how is it that we got here? Why is confusion often the only thing a member can express in relation to their health benefits? Fundamentally, it's because benefit designs were never set up to help members understand what their costs are and what their coverage is. They make sense on paper. They make it simpler to administer, approve, process, reimburse medical claims. But most benefits are built around the companies that support them and the legal documents that codify them. They have not been built to drive member understanding. And so they won't work as a way to drive member behavior. Take, our most simple PPO HDHP designs. We thought high deductibles were going to turn members into consumers. They didn't. Strapping incentives on reimbursement-oriented benefits doesn't solve anything about member behavior, because reimbursement-oriented benefits are not designed to be understood by your members. If everyone in this room, the experts, struggles to predict member costs for services with a new provider under deductible and coinsurance, how can we expect everyday people to do it? We've tried to make benefits drive member behavior, and instead we replaced copays with question marks. That doesn't just drive plan costs. Our members themselves also increasingly bear significant financial burdens and debt as a result of their own confusion on the benefits they're trying to use. So costs keep rising because question marks and confusion don't push members towards better choices. The benefits are the problem, but they aren't what we've been spending our time on. How much time do we all spend working on optimizing provider discounts? How much time do you spend on trying to get members to be healthier individuals? All of that work, which is great work and is moving the needle, it's nowhere near enough to control the costs that we see in the system right now. Right? Most recently, PwC told us 2027 is going to be the worst year in almost 20 years for a health trend. So we all know it's not working. What do we do? One approach is this renewed energy around plans that narrow and tier networks. They often encourage providers to take responsibility for keeping costs low so that members have fewer of those confusing choices. But HMOs, ACOs, payvider solutions, we've been trying to do this for a very long time, and they frequently struggle to handle the broad range of healthcare utilizers that you all manage in your populations. Often, these plans work for a smaller set of members or for a shorter period of time, but to change the trend story, we need a solution that works for all of your members. And if a narrow network is built upon more traditional style benefits, we're going to continue to see that confusion that continues to drive cost. So the next wave of benefits needs to be built for the everyday person, redesigned from the ground up to guide members to high-value care with very simple, very useful cost and coverage information. These member-centric benefit designs are emerging now. Many folks are calling these alternative health plans. And they need to look and feel like what a brand new user of the healthcare system would expect. Copays that are easy to understand, providers that are easy to find, and services that are easily searchable. Don't just ask whether the plan you're considering rolling out is innovative. Ask whether the member experience, plan design, navigation, and tools truly remove the confusion that's driving cost. And frankly, innovation is very, very rarely a straight line from idea to execution. Building benefits around people teaches you that trust is not automatic, simplicity is harder than complexity, and removing friction takes a lot of discipline. At Surest, we are just starting to see that what we can do when we remove confusion from benefit design, and the results are incredibly exciting. We see members starting to shop for care, understanding their benefits, comparing their costs, and finally doing what we always hoped they would do under more traditional HDHP designs, making provider and care choices that reduce their cost and plan spend. We don't need to take choice away. What we need to do is take away the confusion. But even after you remove the confusion, the job isn't done. You still have to re-earn trust, build engagement, and help members unlearn the habits that confusion has taught them. Case in point, my husband Joe recently got a referral for a sleep study, scheduled it, and moved on. When he told me the next day, I said, "What's your copay?" He said, "How would I know what the copay is? How would I know? I've worked at this company for 6 years that does everything it can to tell you what the copay is." That's how deep this confusion runs. Confusion is so ingrained that even when people have all of the answers they need, they still don't expect clarity. Eventually, we are going to close this gap. And with disciplined simplicity, we are going to make clarity scalable. And when all Americans begin to really trust and understand their health plans, the opportunity gets a lot bigger. Benefits that recommend where a member can find the best prices, deals, quality, outcomes, what things will cost, and what might come next. Guidance they trust and can use. Whoever is going to get there first, with benefits that eliminate confusion and guide members seamlessly towards value, will win with this next wave of health plan adoption. So the future belongs to benefits that are simpler, smarter, and built for everyday people. And here's the challenge. Stop asking if your people can navigate a solution you roll out. Start building the system that you know your members will understand. Thank you.